Hello guys, welcome to part 5 of memory based questions for NEET PG. So root values for lateral cutaneous nerve of thigh L2 and L3, this is the correct answer. Park's classification for fistula in NO involves intersphincteric, trans, supra and extra sphincteric and not intersphincteric. Okay. So near term gravida, no movement for 1 day, and NST, no fetal movements for 20 minutes and only one acceleration. What is the next step? So wait and watch, immediate C-section, induction of the labor, and continue NST for next 20 minutes. So according to me, continue NST for next 20 minutes is the correct answer. Now number of urban PSC, so 21 lakhs divided by 50,000, it comes to out 42. That is the correct answer. Now acromegaly confirmatory test, it is IG1 failure of suppression of growth hormones. Now patient with CKD with anemia, which drug can be given? So any poitin should be given with patient with a CKD with anemia, and darbepoetin, if it was in the option, it is the correct answer. Now caspase, activation of caspase is done in a programmed cell death is apoptosis and pyroptosis. These both activate caspases. Now Marfan syndrome features like tall person, visual problems with ectopia lentis. Which gene is involved? FBN1 gene is involved in Marfan syndrome. Now patient with hearing loss and balance problems, Anthony A and B with varicose bodies are present in a histopath image. So diagnosis is schwannoma. So child with visual disturbances and stellar mass with wet keratin on histopathology, suprastellar mass along with wet keratin. Okay, this is characteristic feature of craniopharyngioma. 16-year boy with jaundice, splenomegaly, father has the same in adolescent, MCSC is high. So this is, see, if they are mentioning that father has also the same history of jaundice and splenomegaly, that is hereditary spherocytosis. Now lab techniques which are used to compare and quantify CD markers on cells, that is flow cytometry. That flow cytometry is the correct answer. Anti-SCL70 antibody is associated with interstitial pulmonary fibrosis. Now this is a pedigree question which was given, in which female was involved, male is not involved. Now all the kids, you can see all of the 4 kids are involved, in which it is not distributing in the male. See, the male is involved, no children is involved. Here also the male is involved but no children is involved. Only the females are involving the other children. Here also female is involving the other children. This is mitochondrial in nature and Kearns-Sayre syndrome. This is the correct answer for this pedigree. Antimitochondrial antibody is positive for which of the following conditions? See, I can't recall the options. If you can recall the options, please recall and tell me the options. But the answers are primary biliary cirrhosis. Biopsy of lung is hemosiderin loaded with laden macrophages. The diagnosis will be right ventricular failure. Bacterial component which is used for attachment to fibronectin on epithelial lining, that is due to that component is lipoteichoic acid, that is used for attachment of a bacteria. Now sewage worker with increased bilirubin and decreased urine output and along with conjunctival redness, what will be the diagnosis? Diagnosis is Weil's disease. Now raw milk is consumed and complaints of dysentery in a rural community. Okay, so lab investigations, gram negative, rod shaped, and PMN infiltration on stool sample. So which bacteria is involved? Campylobacter jejuni has all the features that are mentioned above. So this is the correct answer for this. Now, patient with low grade fever, cough, weight loss, fungal culture that is showing narrow based budding and low grade fever. So, histoplasmosis, this has low grade fever, cough, weight loss, and narrow based budding. This is the correct answer. Now, again, patient with fever, cough, hemoptysis, and alveolar lavage septate hyphae with acute angle branching if seen, that is of aspergillosis. Okay, so bronchial alveolar lavage is showing septate hyphae with acute angle branching. This is in aspergillosis, acute angle branching. Then facial pain with vesicular lesions. Rank smear is showing multinucleated giant cell with intradermal inclusions. This is of herpes simplex virus. That direct answer, that vascular lesions, painful lesions, and facial lesions along with the giant cells. Now 65-year-old post-menstrual woman with vaginal bleed, investigation of and that is not investigation, one image based questions of fibroid is given. So answer is intramural fibroid. Image based questions in which intestines of a 1-year-old intestines are moving towards the rib cage. So this is a easy question, much repeated, and congenital diaphragmatic hernia. Now patient with white dandruff-like deposits on the anterior lens surface, that is pseudo exfoliation syndrome. Now image based questions of a 15-year-old female patient with the swelling over the upper eyelid and just above the lateral canthus. This is dermoid cyst. Answer is dermoid cyst. That image I will put in one of my videos again, that image based questions videos, you can see in that. Now guttate lesions in one eye and bulbous keratopathy in the other eye, that is significant of Fuchs endothelial dystrophy. This is the correct answer. Binocular vision is consist of two things, SMP and fusion. SMP is simultaneous maculoperception and fusion. This leads to binocular single vision. Now true about orbital cellulitis, that ethmoidal sinusitis is the most common etiology for orbital cellulitis. Most common cause of squamous cell carcinoma in the base of tongue, and squamous cell they have mentioned mainly squamous cell carcinoma. So this is herpes virus, HPV is the correct answer, not EBV and SCV. Now patient with history of freckles, marked photosensitivity and two basal Sanson lesions aggravated by sun exposure, which DNA pathway is defected? NER pathway, that is nucleotide excision repair pathway, is defective. Now persistent oval lesions 6 months old, history of GERD, oral lesions, and history of GERD on having spicy food, which drug can be involved? So options were lithium, fluconazole, ciprofloxacin, and beta blockers. So if these persistent oral lesions are present for 6 months and history of GERD, then beta blockers are involved in this. So stay tuned. I hope you are getting all the responses correctly. If you can recall more questions, please let me know, and I will be posting more questions soon. Thank you.